Diabetes is very common in the United States, and it's actually a leading cause of vision loss in the United States in adults. What it is, it's a metabolic disorder in which you have increased blood sugar levels for prolonged periods of time. There's three main types of diabetes. There's type 1 diabetes, which is the inability of your body to produce insulin, and so you're unable to process sugars appropriately. And then there's type 2 diabetes, which this is more adult onset. It's when your body actually becomes resistant to insulin, and so your blood sugars rise again, and you either have to take medication or make some changes to your diet and overall health. And then the third one is gestational diabetes, which occurs in pregnant women. So how specifically does diabetes affect the eyes? The abnormal blood sugar levels can end up damaging the small blood vessels inside of your eye, and what happens is those blood vessels will leak fluid or blood into your retina and can actually cause your retina to swell, which would effectively change your vision. Another thing that can happen is over long periods of time in this kind of an environment, your body will actually start growing abnormal new blood vessels within your retina that reach into the main body of your eye, and this can actually lead to some type of retinal detachment. And that's pretty far progressed in diabetic retinopathy, but that is some of the things that it can lead to. It can also change the lens inside of your eye by increasing the rate at which you produce a cataract, making your vision cloudy as well. So we like to see diabetic patients each year, and if it's more serious, we do see people often more than once a year. And what we do during an eye exam in a diabetic patient is we dilate your eyes and look for any damage inside of the eye. We also collect information from you about your A1C, your blood sugar, and how you've been controlling your diabetes, and then we actually communicate that information with your primary care doctor or your endocrinologist, whoever manages your diabetes. We are in touch with that individual and reporting, yes, there's changes in the eye, or no, things look good, we'll just see you in a year. If we do see some more serious changes inside of your eye, we can refer you for surgery if it's needed, in which they often use a laser to actually clean up some of the damage that's happened inside of your eye. But if nothing looks out of the ordinary in a diabetic patient, we see you about every year or so.